What is health and social care research, and why does it matter? This video is about health and social care research. The video talks about what health and social care research is, and why does it matter. When we do research, we are finding out the best way of doing something. For example, finding out what is the best way to manage diabetes. The NHS does a lot of research. Health research improves the advice and treatments we get from our doctors and the NHS. For example, finding out if a new medicine is better than the one we are using now. Health research improves how we look after our own health in our daily lives. It improves the health of our communities. It improves the care we have when we are patients in hospital. It improves how the NHS works. Social services also need to find out about the best way to care for people. This is called social care research. Social care research helps us live more independently. It improves the care we have in our own homes. It improves the care we have in care homes. It improves how social services works. Health and social care research is very important. Quite a lot of people, however, have not really heard about health and social care research. Some people have heard about research only through being in hospital or from TV. But over 1 million people take part in health and social care research in England every year. That's enough people to fill Wembley Stadium nearly 12 times over. Health research is helping us to live better and longer with many illnesses. Illnesses like cancer, dementia, diabetes, long COVID, allergies, and heart disease. So how do we do research? One way is to ask people about their experience of healthcare. For example, a researcher can interview people about their experience of pain when they are trying a new treatment, or interview them to find out how well they are supported with their health and care needs when they have, say, cancer treatments. Another way to discover if there is a better way of providing health and care is by asking people to fill in questionnaires about how well they are getting on with a new treatment. Other times, researchers bring people together in a group to discuss their experiences. An important way of doing health and care research is by doing a clinical trial. Clinical trials compare a new medical treatment to the usual care that is already available. This could be something like a new medicine or a vaccine. It could be a new way of doing an operation. It could be something like a pacemaker or a new type of scanner. It could be something like a different therapy for severe anxiety. In a clinical trial, some people will get the new treatment whilst others will get their usual care. The person taking part in the trial and the researchers do not know who gets the new treatment and who gets the usual treatment. The researchers will only find out what treatment someone has had at the end of the trial. This means we can be sure if it is the new treatment that is making a difference, if there is one. Clinical trials are complicated and expensive. there are other ways of finding out if we can improve health and social care. Researchers also look at the information which is collected about us when we have care. For example, when we have heart disease or other illnesses and injuries, everything that happens from when we first see our GP to after our treatment is finished is collected and stored on a computer. All this patient information which is stored on computers can be looked at. Researchers look at this information from many thousands of people's healthcare records. They can then see if there are better ways of treating and looking after people. Good health and care research is important for all of us, from a newborn baby to someone who is over 100 years old.